Our mission at Austin Public Health is to prevent disease, promote health, and protect the well-being of all. In this video, you will learn how easy it can be to get low-cost vaccines for children who have Medicaid or no insurance, and adults with no insurance at Austin Public Health vaccine clinics. No proof of citizenship or immigration status is needed to get a vaccine, and we do not share your information with law enforcement or immigration agencies. These clinics, also known as Shots for Tots and Big Shots, are located in both North and South Austin and offer all the recommended vaccines for children and certain vaccines for adults. Call 512-972-5520 to find out if you qualify and to schedule an appointment.
This is 𝗙cie𝗹𝗹. How can I help you?
One of our friendly call agents will set up an appointment based on available dates and times. If the patient requesting an appointment does not speak English, they may ask a friend or family member who speaks English to call. The call agent will ask the caller in English which language the patient speaks. The call agent will then create a conference call with the patient and an interpreter to set the appointment. If the patient needs a sign language interpreter, we will schedule this interpreter to be at the vaccine appointment. We serve thousands of people in need of vaccines, and our phone lines can get busy. You may be placed on hold for a period of time before speaking with an agent. Stay on the line and you'll be on your way to receiving your and your family's vaccines. We will ask a few simple questions about the person getting vaccinated. Complete name, date of birth, race and ethnicity, health insurance status, preferred language, phone number, home address, and vaccine history. The day of the appointment. Please bring your vaccination record and birth certificate or another form of photo ID, such as a passport or government-issued ID. Plan to arrive 10 minutes before your appointment. Please note that your appointment begins with our clinic staff gathering your information. If you get to the clinic more than 10 minutes after your scheduled appointment time, we may not be able to see you and you will need to reschedule your appointment. Our dedicated staff works hard to keep everyone on schedule, but sometimes there may be a wait inside the clinic. Let's review what we learned. Call 512-972-5520 to find out if you're eligible for a vaccine and to make an appointment. Bring your vaccination record and birth certificate to your appointment. Arrive 10 minutes before your appointment. At the clinic. In this video, you will learn what to expect when you visit one of our vaccine clinics. Please plan to arrive 10 minutes before your appointment. Be sure to give yourself enough time to reach the clinic and find parking if you are driving or if someone is driving you. When you enter the clinic, head towards the Shots for Tots and Big Shot sign where our friendly staff is located. Please note that your appointment begins with our clinic staff gathering your information. If you arrive more than 10 minutes after your scheduled appointment time, we may not be able to see you, and you may need to call 512-972-5520 to reschedule your appointment. Once you are inside the vaccination clinic, our staff will start by asking you for your full name and date of birth. Please be ready to provide your vaccination records. This can be paper, electronic, or a clear photo of the records, and your birth certificate or photo ID, such as a passport or government-issued ID. Having this information ready helps to provide a smooth and pleasant experience for you and your family. Once your appointment is confirmed, you will be handed an electronic tablet. This is a small touchscreen computer. You will use this tablet to complete some forms. You may take the tablet to your seat and enter your information. If you need help filling out the forms, please ask one of our friendly staff members. If you requested a sign language interpreter when you made your appointment, they will be available at the clinic when you check in. After completing the forms, hand the tablet back to the staff and have a seat until your name is called. Getting the vaccines. You may have to wait inside the clinic, but our dedicated staff works hard to keep everyone on schedule.
Miranda?
Once a nurse calls your name, you will be guided to a private room where you will receive your vaccines. Let's review what we learned. Arrive 10 minutes before your appointment. Give yourself enough time to find the clinic. Check in with the clinic staff. Provide your vaccination record and fill out some forms. Have a seat and wait until you're called to see the nurse. With the nurse. In this video, we want to share what to expect when you meet with our nurse for your vaccinations.
Miranda?
After you're called to see the nurse, you'll be guided to a private room. Privacy is important to make sure you feel comfortable receiving the vaccine and helps keep the information shared with the nurse between you and the nurse. In the room, the nurse will ask for your name and date of birth. These questions help us verify the nurse is with the right patient. If you requested a sign language interpreter when setting up your appointment, they will be available. After confirming your identity, the nurse will discuss the necessary vaccines and address any questions you might have. Each vaccine is administered one at a time. The nurse will use an alcohol wipe to clean the injection site, carefully administer the vaccine, and then put a bandage on the area. After making sure you are feeling okay, the nurse will take you to the checkout area. Let's review what we've learned. You will get your vaccinations in a private room. The nurse will talk to you about the vaccines you will receive. The nurse will clean the skin where the vaccination will go. Then the nurse will give you your vaccines. Checkout and follow-up. In this video, you will learn what to expect after receiving your vaccines and about the checkout process. After receiving your vaccinations, the nurse will take you to our checkout window. If you requested a sign language interpreter when making your appointment, they will be available. The cashier will review your name, date of birth, and vaccines given during the visit. Our clinics charge $13 for each child vaccine given and $25 for each adult vaccine given. You may pay with cash, check, debit, or credit card. The cashier will give you a receipt and return your updated vaccine record. At Austin Public Health Vaccine Clinics, we do not deny services if you are not able to pay, so just pay what you can. Simply speak with our cashier, and we will be happy to work with you. We are just excited for the opportunity to serve you. Sending us your feedback. After leaving the clinic, you will receive a text message with the customer service survey link. Please click the link to complete the survey. Your feedback helps us to improve the overall experience for everyone. Scheduling future vaccines. If you need more vaccines in the future, you can call 512-972-5520 1 week before the vaccine due date to schedule a new appointment. Please note that the staff at the clinics do not make appointments. Let's review what we learned. We will not deny someone a vaccine because they cannot pay. Call us again to keep you and your loved ones up to date with vaccinations. If you have any questions, please call 512-972-5520. Thank you for trusting us as we work to provide you and our community with the best care possible.